Welcome to the video for professionals using the PostureZone app and interested in building a posture practice. Using posture analysis as a way to educate people about the importance of posture, promoting annual assessments for an active, pain-free life, as well as using posture to identify the cause of posturally related back pain, neck pain, stiff joints, and headaches. And the solution, which can include therapies such as you're already using right now, from chiropractic to muscle therapies, and including exercise therapies, especially strong posture exercises focused on strengthening balance, alignment, and motion. The posture zone concept is to focus on how the body is balancing the four posture zones, how the head balances on the torso, which balances on the pelvis, which balances on the center of pressure of the lower extremity or the legs where the feet are hitting the ground. Strengthening posture means strengthening the function of how the body is balancing and aligning and moving these four posture zones in an interdependent spiral. Your posture is how your body is balancing your body. At the end of the day, all body motion begins with posture, and posture begins with balancing your body, keeping your body vertical. Recent studies have shown that the orientation of gross body segments with respect to the gravity line is superior to local spinal pelvic features in terms of clinical importance. In other words, a high left shoulder or a high right shoulder is less important than how the head is balancing over the torso, over the pelvis, over the ground, according to this study published in September 2012 in the prestigious Spine Journal. Consider promoting the idea that if you spend 18 hours a day sitting with your body folded, then posture will fold and people will stand and move and feel old far before their time. We teach and train strong posture exercises. We teach strong posture exercises and train CPEPs, Certified Posture Exercise Professionals, to help people move, feel, and be well. People such as the people you're taking care of. The strong posture exercises are in the book Stand Taller, Live Longer, and again promote the idea that you have to keep moving well as you age to keep moving well as you age. Posture exercise strengthens posture as well as your sense of balance, as well as your alignment, as well as how you move your body. Which brings us to the PostureZone app. It's a simple app. The goal is to move the device so that the person is between the top and the bottom bracket. If you open it up and you press the camera button, you'll see a camera. If you move the device back and forth, you'll notice a red level line. When the device is level, the line turns green. Click the camera button and then select the view, side or front or back view. Hit the button again and you'll have brackets for the posture zones, head, torso, and pelvis, and the center of pressure of the feet. Move the zones back and forth. The torso and pelvis can be moved independently. The goal is to have it be consistent for each time you work with a person. We suggest on the front view having the inside of the notch at the top of the shoulder and the inside of the notch at the waistband. On the head and feet, you can pinch to spread apart or move back together the brackets. The torso and pelvic brackets can be pinched on the side view as well. When you have the brackets around the person, click the check mark at the bottom, and you'll get an assessment that will be saved in pictures and also able to be shared on Facebook, Twitter, or with the pro version by email and iTunes. The picture shows the deviation around the central pressure of the feet of the hips and the torso and the head, giving a left-right balance of the torso and the pelvis and a left-right balance of the head over the feet. It's a simple way of looking at posture, how the body is balancing. If you want to learn how to take pictures again, you come back to this information button. Find Pro is for people looking for a local posture professional. That's probably you. Prior pictures taken with this device are under Pictures, and Improve helps people to interpret the results and learn about posture. From a professional point of view, PostureZone is a tool to help create posture consciousness. If you're a CPEP or in the CPEP program, you know that Posture is the function of structure. If you're a professional who works with posture, you likely agree with this statement. Posture is the function of structure, which is why taking a posture picture of all patients makes sense if you're working with posture, and tracking that and communicating how you're tracking that to people and empowering them so they in turn can track and check their own posture. This builds posture consciousness, and this is one of 3 legs of building what we call a posture practice. Teaching people how to be aware of their posture and control their posture, and making that the theme of the practice from assessment to treatment to education. Using posture concepts to educate them. In Biomechanics 101, the 5 posture principles from Stand Taller, Live Longer, and teaching them how to control and strengthen their posture with the strong posture exercises, using the must versus try protocols and BAM, balance, alignment, motion, interaction, to functionally strengthen how someone's moving, and using that awareness of how they're moving to make a difference in literally how they're standing that you can visually see with a posture picture, which in turn closes the loop of a virtuous cycle and builds posture consciousness. Beginning a patient interaction with a question, how's your posture? Not just how is it today, what's it going to look like next year, and what is their best possible posture? The goal is building posture conscious patients and clients. You can just use PostureZone on the app. You can use the desktop version of PostureZone to print out a printed report with other clinical findings, as you see here as well. The point is creating posture awareness and posture consciousness and tracking that, because then when you make progress, people get excited. And that's the key to engaging people, to having them value what's going on and being aware of it. And it's a great tool to position and market your practice. Man will only become better when you make him see what he is like. And a picture makes somebody see what they are like and what they look like. And that's the great utility behind the PostureZone app. It's a free app. You want to encourage people to take posture pictures. Teach them how to take posture pictures. The difference between the PostureZone and the PostureZone Pro is in the Pictures button. For PostureZone, it's intended to track personal changes for a person, so they can flip back and forth between today's pictures and last week's pictures and last year's pictures, or with the pictures of their friends. If you're a pro and you're using this version, you can also track this by case, and you can add people to the app by cases and follow their progress over time. For the personal app, by teaching people to check posture, their friends, family, coworkers, anybody, you're making them posture aware, you're making them know and talk about posture, and when there's a posture-related problem, they know that they're going to see the posture expert. That's you. The PostureZone Pro version that you're using right now, you can email the picture to the person from inside the app. When you're doing screenings, you can double tap for even more precise placement of PostureZone brackets, and you can export the pictures to other programs using iTunes or email to put it into a clinical record. If you want to learn more about the PostureZone system of assessing posture and functionally strengthening posture, you want to become a CPEP and take the CPEP program, the 12-hour live course, or do a one-to-one web evaluation. Beginning point is Posture Practice Online, the 15-hour online course that's good for CE for chiropractors, most massage therapists, and other professions as well. And to become certified, you need to show someone that you can both do and cue the exercises either in person or remotely on the web, and also learn how to build and position your posture practice with the posture practice webinars and 15 weeks to a posture practice in CPEP 321. One of the great parts about the CPEP program is now with the PostureZone app, if people click on the local help button on the app and you're in the area, they find you if you're a CPEP. If you're not a CPEP, but you are a posture professional, listings are available on the app as well. For information, look at posturepractice.com for CPEP. Look on strongposture.com for information on Fine Pro listings, as well as the 7-week The Strong Posture program, Stand Taller, Live Longer, and PostureZone.com both have more information about tools for building a posture practice. And to learn more about posture in general and how posture can help you move, feel, and be well, check out BodyZone.com. My name is Dr. Stephen Weiniger. I wrote Stand Taller, Live Longer, and I encourage you to become a CPEP, learn the strong posture protocols, and help your people move, feel, and be well.